Do you have a disc herniation and a spine surgery was recommended for you? Among different parts of the world, different strategies have been adopted to treat spinal disease. There are numerous non-surgical treatments, but when the patient is losing strength, there is functional impairment, or the pain is terrible, or is not going away after several weeks of medical treatment, a surgical approach should be considered. Some centers still advocate that spine fusion is the main solution to treat simple disc herniations. Others advocate that the most modern surgery is the disc replacement with an artificial disc. The fact is that the majority of disc herniations doesn't require surgery at all. So why would those that require surgery need a major one, like a fusion or a disc replacement? Full endoscopic spine surgery is a minimally invasive technique that should be considered in the majority of spinal compressions. Recent publications consider this the new gold standard technique for lumbar disc herniations. But besides lumbar disc herniation, lumbar stenosis, cervical and thoracic disc herniations and stenosis, many different kinds of compressions in the spine can be treated by endoscopic surgery, as well as some spinal instability that need fusion might also be treated with endoscopic techniques associated with minimally invasive spinal implants. Full endoscopic spine surgery is routinely performed in our day hospital since 2015 as outpatients. Patients are able to go home after 2 or 3 hours of the procedure. Usually patients that come from other states or countries stays in our city for a few days to 1 week before traveling back by plane to their home. And it's usually possible to visit the city after the procedure to also enjoy some tourism. If you like this video, follow us on social media to watch more.